Medicare is not free. Let's talk about the costs associated with Medicare Part B, which is your coverage outside of the hospital. There are two main categories of costs associated with Medicare Part B. First is going to be monthly premiums, and second is going to be your cost share. Typically, you're going to pay $185 a month for Medicare Part B in 2025 unless your income is over a certain threshold. If you make over $106,000 filing taxes single or $212,000 filing taxes joint, you will pay more than the $185 a month. The next category of costs I mentioned is cost sharing. So what am I talking about? Medicare was never designed to cover every dollar. So when you have a Medicare approved claim, Medicare is going to pay most of the bill, but not necessarily all of the bill. And that's where cost sharing comes in. I'm going to discuss two of the main costs associated with Medicare Part B when it comes to cost sharing. Now, before I go into what the cost share is, remember, you can get a Medicare supplement policy to help cover some of the dollar gaps of a Medicare approved claim. The first cost I want to discuss is the Part B deductible. In 2025, that is $257. The 7 seems to be missing up there, but that is an annual deductible. And you no longer can cover that by a Medicare supplement policy. For those of you already in a Medicare supplement policy, if you have Plan C or you have Plan F, it covers the deductible. But for the rest of you, you're going to be paying that $257, and after you've met that burden, that's when Medicare's obligation kicks in. The next cost share I want to address, which is the big one, the biggest reason why you get a Medicare supplement policy, is the Part B coinsurance of 20%. So what do I mean by that? Once you've met the Part B deductible, Medicare is now on the hook for 80% of your bill. That leaves 20% that is not covered by Medicare. Now that 20% is uncapped. So if you have a bill for $1 million or you have a bill for $100, you are going to owe 20%. And that is why you want to get that Medicare supplement policy, so that you protect yourself from that 20% gap. So you can see above me the 10 plans that are still available in the marketplace. And for C and F, you have to be already grandfathered into it. But in the meantime, you can see that most of them, I wrote 100% underneath it, meaning they're going to cover 100% of the remaining 20% not covered by Medicare. But there are a couple ways that you could lower your monthly premium on your supplement, and let's talk about those. So if you look at K or L, you could have your supplement only cover 50% of the 20%, or with L, 75% of the 20%. It means a lower premium, but it means higher exposure for you for out-of-pocket costs if you have a big bill. A lot of people gravitate towards Plan N because Plan N has a premium that is lower than G. G covers 100% of the 20%. N covers 100% of the 20%, however, minus a small copay, up to a $20 copay for a doctor visit and up to a $50 copay for an emergency room visit. So how would the math work? Let's say with Plan N, you had an emergency room visit and there was a $1,000 balance left. Medicare covered 80%, $1,000 is the 20% remaining. What would happen is your supplement would pay that entire $1,000 minus the $50 copay that you would owe for an emergency room visit. So the important thing to understand from this video when you're thinking about retirement, when you are budgeting, is that there are costs associated with Medicare Part B. You're going to have that monthly premium, and then you can cover most of these dollar gaps, but you are then going to have a monthly premium for your Medicare supplement policy. And the cost is going to be determined by which plan you choose, the letters behind me, and it's going to be determined by your zip code, your age, lots of different factors that determine what that premium is going to be.